secondary success group for community of practice. This is our January meeting. I'm also here with my colleague Kylie Freeman, who is from our CTE unit, and many of you know her as our Perkins State Director. Today we're very happy and grateful, and many of you probably have met Linda Richard. She's right here in person. She's going to be doing a presentation today. She's from the Waterbury Career Academy in Waterbury. She's got an extensive background and knowledge, and we're very excited to have her today do a presentation on her career pathways and IRCs linked to Waterbury Career Academy. So with that, I'm going to push it over to Linda. Go ahead, Linda.
Okay. Hi. So good morning, everybody. And thank you guys for inviting me to present. And I hope I can deliver on those two very important topics of industry-ready credentials and credentialing and certifications. So I'll share my screen now and we'll get started with the presentation. Let's see here, tab. Okay, so hopefully my contact information is there. I still.
Oops, we don't see your presentation yet.
Oh, let's see. Choose what you want to share. Oh, here we go. Got it. Can keep people alive, but there we go. Can you see it?
Yes.
Okay. All right, so Career Academies 101. This presentation, some of you might have seen it. I've expanded on it from a 2024 presentation that we did at Central Connecticut. So I am the CTE department chair here at Waterbury Career Academy. We are, so in my presentation today, I hope that you come away with understanding the components of a well-planned program, how Perkins relates into utilizing Perkins funding and grant funding that you had that are available to us, and the benefits of certifications and dual enrollments. Okay, so basically my Bible that I follow is a book by Hans Meter, and it is The Power and the Promise of Pathways, preparing American students for career and life success. And Hans's definition of a career pathway is interconnected academic and elective courses. CTE, and very simply for me, is meant to connect the career and tech ed courses with the academic sides of the building. So our story, in 2013, Career Academy opened. It had been in the planning for about good 5 or 6 years before it opened. The impetus for it was meeting critical areas of need for the Waterbury jobs market, and educators and Waterbury leaders noting that our students, Waterbury students, weren't being accepted into the tech programs, essentially Canaan Tech, and we needed to up the ante in our public schools. So that's how Career Academy came to be. Over the years, we have rebranded. We've gone from calling ourselves Strand to Pathway, now to Academy. So rebranding the names, and then for me, the Academy, it should have always been Academy, but we got to the point of where we distinguish ourselves as that school within a school concept. So students enter here in the 9th grade. We are not a lottery. We are not a magnet. We are open. We are application. So students from all points of Waterbury are allowed, have the ability to apply to Career Academy. We are a school, and I'll get to my number slide, but we're a school of 800. So we get approximately 500 to 600 applications for 200 spots. Students come in. Students come in 9th grade, and they filter through our 4 academies. So we have health science, we have manufacturing engineering, and manufacturing engineering, computer and business, health science, and then human services and education. Our grades 10 through 12 offer more concentrated learning that lends itself out to all the things we're going to talk about today. This is us we're at a very high point in Waterbury. I drive up a very steep hill every day to get to Career Academy. I included this slide. We are a public school. People will say, you're a public school, but you have career pathways. So are you a technical school? We're both. So connecting to your community, having our sports, having our art and music, and all of the everything that goes with a public school is what we are. We are not zoned. We have 19 buses that deliver students every day to Career Academy from all reaches of the city. So in beginning in the pathways back in 2013, my challenge was coming up from Florida. I had taught 7 years in Palm Beach County. And the school I taught at, the first medical science academy, was created in 1985. So I came up here when I came up to in 2013 to open up Career Academy. I came with a lot of know-how on how to run an academy. So getting up to Connecticut and getting up to speed with funding, aligning coursework with the State Department of Ed, understanding the career clusters that Connecticut had adopted, the 2-course sequence, making myself familiar with the college and the ECE courses and the work-based learning, and just getting to know the community. I am a rule follower. I check the boxes. As a nurse, that's who I am. So I make sure that all of our coursework and our pathways are all meeting SDE, state and local requirements. A couple must-haves: your instructional team, your leaders within the building, your program specifics. For Career Academy, we have the 4 academies. So within each academy, making sure standards are, our curriculums and our courses are aligned with standards. Our UConn ECE courses are connected, that our industry recognized certifications are relevant to the coursework that we're offering, and also using our Perkins funding for the equipment that all funnels into our project-based learning, and having the necessary space for our needs. Okay. So reflecting on our beginnings, we opened in 2013, and as I said in the couple slides before, we were concerned about the critical areas of need in Waterbury and in the surrounding communities. So the academies that we have with manufacturing, and believe it or not, health wasn't an afterthought, but it wasn't really what the planners of the building thought was going to be the successful point, or the career that most of the children would engage in. So manufacturing, the IT and the business, and then when we first opened, it was it was human services, so that lent itself to like child development, social work, pre-K education. But looking at all the updates that have happened in education in 2018, the updates, and most recently in 2025, the updates with the subclusters that we just were presented in September, I'm confident, and I know that what we started with in 2013 is still relevant and meeting the needs of the updates. So in September, the meeting with the Perkins work group, introducing the changes and the updates to the career clusters, looking back on that information, caring for communities, the building and moving, the cross-cutting careers, and investing in the future. I look at that and I say, okay, Career Academy is still hanging in there. We are aligning with the updates, the caring for communities within the healthcare and human services cluster. Now that is combined. Again, I look at what we're doing here and I can say that we are doing the work and managing these updates. So now I'll get into our pathways and what specifically each pathway carries. So our Health Science Academy is for students who wish to enter healthcare. I've highlighted our dual enrollment courses. So in health science, we have our UConn Introduction to Allied Health Professions, our nursing assisting, our UConn medical terminology, and our UConn EMT. In addition, we have surgical tech and EKG and pharmacy technician. I never say no. So when courses like surgical tech came to be was the OR nurse from Meriden Mid-State contacted me just coming out of COVID and said, we need to rebuild our workforce. Linda, is it feasible for you to put in a surgical tech course? I said, absolutely. And then I had to go down to my principal's office and say, like to add another course to the lineup. And he just, hangs his head. So, okay, Linda, where's it going to be? And I said, well, I'd really like first period. And that was my last big ask in the health strand. So we have surgical tech and EKG and the 3 pharmacy courses. For me, it's most important to create multiple exit points for the students. So offering these 8 courses allows students to explore many facets of what allied health is all about. In addition, our OSHA 10, all students in the Health Science Academy get CPR, AED, and first aid training and certification. Our EMT students get Stop the Bleed, and we have a nice public health ambassador training that we include for the 10th graders in this pathway, put on by our local Northwest AHEC.
Hey, Linda, before you go on to your next slide, I just want to ask you a question. Maybe you can explain a little bit more. If a high school did not have a health science academy like you do, how could a high school that doesn't have health sciences like this build up something simple? So you're a registered nurse, you have all this background, and it's great. But what about a high school that wants to add a health science option? What would be something that another high school could add at an easier level? I don't want to say easier, but like if you didn't have a nurse operating it.
Absolutely. Well, so in order to be a CTE teacher so let me back that up. Running it through the science department is usually, so for example, in Waterbury, the Waterbury Arts Magnet School, they are predominantly art school. And in order to fulfill the STEM requirements, they needed more science. And so through the science department, so I worked with the science department chair, and they brought in UConn medical terminology. So a biology teacher could teach UConn medical terminology. So that could be an introductory course. But when you're teaching in health science in CTE, you have to possess a health occupations license. So if you're not a registered nurse, you could be a physical therapist, but you have to possess a current and active health occupations license with the Department of Health.
Thank you. And while we're on this slide, does anyone have any questions for Linda? Thank you, Linda.
Okay. So just some pictures, creating real life environments in the classroom. So this is something that I, do set out with our surgical tech students. And here they are. It caught on very quickly, the surgical tech course. Real life prepping for the OR, the personal protective equipment, working on the mannequins, just getting them hands-on situations. And here's a senior EKG student placing electrodes on, correct placement for doing an EKG. We also did 3 lead EKGs on each other. So part of what they had to do was to produce an actual EKG. That was part of one of their lessons. So we did have them working, I did have them working on each other and getting a real live EKG. Okay, next up is our Education and Community Services Academy. So Career Academy we've split this pathway in 2. We have students in the pathway who want to go towards child and human development careers, and then the other half is for teacher preparation. So when the State Department of Ed and the initiative for the Educator Rising program came through and grant funding was available, I can tell you here at Waterbury Career, we have made the most of all of that initiative. When initiatives come through and, oh, we're going to do this, we're going to do drones, we're going to do this, and then you have to say, okay, who's going to teach this? What teaching specialties do we have? Who's going to teach these courses? So this is where you get creative. So our special education teacher, we moved her. She did the work, did the coursework, received her certification, and we with administration, we moved her from her special ed teaching certificate to a career and tech ed teaching certificate. So now she heads up our teacher prep academy. So we have teacher prep 1, 2, 3, and 4. And Erica also got certification to teach the Yukon Love It and Teach It and the Introduction to SPED. So we're preparing our students for direct entry into educational majors. We do have a pre-K in our building, so we have 18, we call them the littles, and then the kids on the upper floors are the big kids. So we are able to have our pre-K students involved in our education students' externship opportunities, visiting the pre-K, our 10th grade students who are in child development are able to go down to the pre-K and observe and interact with the students. So our future educators, highlighting Olivia, graduated. All these students, I believe, are now in their 2nd year of college. Olivia is at Rice, Craig is at University of Hartford, and Madeline is at Vanderbilt. These students were exceptional students, and here they're shown here at the at Central with the Educator Rising State Conference. And then they went on to Washington, D.C. Yes.
Excuse me, Linda, we have a question. Dave raised his hand.
Mm-hmm. Hi, Dave.
You should be able to come off mute.
Okay, I think I just unmuted. Okay, yeah, quick question on the educational pathway.
Mm-hmm.
I'm exploring, it's called a Child Development Associate credential. Has that come across your space at all?
Yes, it has. Very early on, like way back in 2013. The Child Development Associate requires, at the time, I believe it was almost 400 hours of externship and clinical experience.
Yeah, I think it's been necked down to about 180 hours or so.
Okay, and even at that, Dave, that's a lot.
It
So
is. It is.
it is, and in this world and of, I mean, we're losing nursing assistant programs left and right because lack of clinical sites and lack of clinical hours, and the CNAs only need 60 hours. So CDA was on the planning docket when I came here in 2013. I researched it and I says it's too much for the high school student. And so Dave Thompson, okay. So for our setting, we just didn't have the resources for it. So we did back it down to the Parapro certification, which allowed the students to gain access to a career, an entry level access to the classroom through a paraprofessional position.
All right. Thank you very much.
Okay.
We have another question, Colleen?
Colleen.
Hi, well, not so much a question, but just for David, we at Waterbury Academy, we currently have a program that we're running for CDA. So I can get your contact information after and I can talk to you about our experience with that. It's 480 hours total that you need actually with the program. It's a lot. We've had one student last year finish everything. There are ways to kind of work those hours in, but I can most certainly share our experience with you and then I can help you along with that.
Thank you. So are you doing the pilot with the workforce board or no?
So we did a pilot last year. Yeah, so then like this year we're working with eWIB is helping us out this year.
Yeah.
Yeah.
Okay. Thank you very much.
You're welcome.
Okay, can you all see again? So our educator students do externships throughout. This student, I believe, is at Wilson Elementary. We have an elementary school right down the sidewalk, so our students can walk to their externships, and they are lesson planning and delivering lessons in the elementary setting. So our next pathway is our engineering and manufacturing. And of all the pathways, this pathway has really gone through the most changes. We started out with traditional courses of milling, lathing, bench work, grinding. We've since then rebranded to go along with our collaboration with, before it was Naugatuck Valley, now it's CT State. And our curriculum is 10th grade foundations in manufacturing, and then our 11th and 12th graders are in advanced manufacturing 1 and 2. Their coursework here in high school transfers over to the advanced manufacturing certification at Naugatuck Valley. We also have a visiting instructor from Naugatuck Valley, Anthony. He comes in on Wednesdays, although I was down in the shop yesterday and he was there because they're on break. So he comes in and works with the students on their projects. And on the engineering side, we have drone technology. So design and assembly there, we have a standalone course in drone technology. And again, when the district said, "Oh, we want to bring drone in," you said, "Okay, then the question is, okay, so who's going to teach it?" And so for me, I kind of went down and talked to our physics teacher, who I said, "You're a gadget guy," very very just kind of off the cuff. And I said, would you be interested in teaching drone? And again, just like our Erica in our special ed department, he put the work in, got the CTE certification, and now Vin teaches 5 physics courses, and his 6th class is drone technology. So getting creative with your staff. Pictures of our shop. We have 3 Bridgeport machines. We update our equipment every couple years. Our principal, and that's our principal in the background, building out the shop, changing, enlarging doorways and moving equipment around so we have the most up-to-date equipment for the students to be working on. Okay. Trips out to community events. And our Information Technology and Business Academy. So within this academy, we have courses in software development, IT, essentials, game design. Again, another course that was introduced that we brought in. And initially in 2013, the IT was going along, and again, this was all new to me, through an Arduino and Cisco system. We realized that curriculum and that pathway wasn't something that was going to be successful. And so we've rebranded it and gone more towards CompTIA, their curriculum platform. As I said, we've added the game design. And in this strand, we have 2 post-university courses. We have 2 teachers in this pathway. One of the teachers is a postgraduate and a former business owner. So he came to us, from industry, and a post-university graduate. So he teaches the foundations of leadership and principles of management. And certifications. So with CompTIA, A+ certifications, and then our precision exams, which I'll get to. So our current academy enrollment. So this year we're carrying about 249 students from 10th to 12th grade in the Health Science Academy. Manufacturing and engineering has 90, education, training, and child development has 103, IT and business, and then our standalones, game design has 22 students enrolled. Our drone has 16. With the state's mandate graduation requirement for financial literacy or money management, we had to create 10 sections of money management. So we have 237 students in those classes. And at Career Academy, the financial literacy graduation requirement falls under CTE. As the state increases graduation requirements, a couple years ago it was humanities, and now we have the money management. It affects the CTE coursework. In a school like Career, where we have a traditional 7-period schedule, we can't fit in, we have to do our graduation requirements, but our CTE classes are kind of getting edged out. So, example, I used to have 4 sections of UConn medical terminology. This year we have 2. And our numbers have remained the same. We carry about 250 students from 10th to 12th grade, but the students now have to meet graduation requirements, taking those sections, those periods away from a CTE class. So the next couple slides are just snapshots of students at Career Academy within all of our pathways. Career and technical student organizations. So we have HOSA, which is Health Occupation Students of America. We also have DECA. And in 25-26, we have our future educators, career and technical student organization. So we have 3 CTSOs at career. Community service projects with the education and training. With the future educators and the education and training academy, they're required to have a monthly community service project. So for my HOSA group, we do blood drives a couple times a year. So so the Future Educators Academy, they're going to be hosting the spring blood drive. But this month they are collecting snacks for St. Mary's Hospital, for the hospice unit at St. Mary's Hospital. So community service is a big part of what we try to pass along within each of the academies. Students, our EMT students, backboarding, basic life support, choking, CPR. Our CTE, our future educator students, teaching classes, going into classrooms around the city, teaching lessons, preparing lessons. This is that physics class that I talked about, hands-on activities, our manufacturing. Our partnerships, this is myself taking a group of students down to Southern Connecticut. Gear Up is a initiative in Waterbury where it guides students to college entry and facilitates their college path. Future educators going to the state capitol. And then there's an example of those are our pre-K students doing an activity outside when the weather gets warmer. Partnerships that we have created over the years. So our health science students are invited to the UConn School of Pharmacy. And I think this is our 3rd year in a row going. I've just booked the date for April 1st. So we take students, so we'll be taking our UConn EMT students and our UConn Intro to Allied Health students. And we go up to UConn stores for a day of lab activities, and it's tremendous. So these are our actual students working in the pharmacy lab, learning injections, and then on the other side, they're compounding medications. Every year, our UConn branch, our Waterbury branch, invites all of our 11th grade students, which I have 75 11th grade health students, to UConn Waterbury for a day of activities and information on admission. And then we have a collaboration with the UConn Health Center in Farmington, and we take students up there to explore a day in the medical lab science department at UConn Health Center. So these are students that are actually, again, they have activities, hands-on activities for them, and they're touring them through the medical lab science department at UConn Healthcare.
Can I ask you a question about, so we
Sure.
have great partnerships. Which funding sources do you use at your district to transport the kids and get the kids there? Is this Perkins funds, or do you have local funds that your district has set aside for you for all these partnerships? Or the
Okay, great.
combination?
So I should have prefaced this. We do have a school van. We have a small school van, a 15-passenger van. So for short trips like this one to the medical lab, I'll drive the van and I'll bring the kids up to the health center, because we have, we can only take about 5 or 6 students at a time. Our funding, yes, does come. Buses do come through. They can either come through Perkins or through our local, principal's account. So the trips that I have coming up, I will ask my principal to fund them, or I have a fundraising, I have an account in my health science, under health science, that when I do fundraisers and things, the money goes in there. And it also helps to support the consumable items, gloves and soap and things that are consumable that we know Perkins doesn't support. So it's a combination between Perkins funding for the big things like the state tournaments and transportations for that. These smaller trips, we are usually supported through our Waterbury Public Schools.
Thank you. Does anyone have any questions for Linda as we're on this slide? Or there was one question we had earlier, Linda, that I forgot to ask you in the chat. When it comes to age requirements, some things you work on, it's a 16, sometimes it's an 18. So, high school ages vary for your kids. So how do you handle when an age requirement is around for certifications?
Okay, well, the only, in terms of high school in the state of Connecticut, the certification / license is the nursing assistant. And so between the Department of Health and the State Department of Education, in the high school setting, in a high school nursing assistant course, the students, I've been doing this so long that for students, they can be 16 and take the test, but that's not advisable. So when we are enrolling students in our CNA program, I ask that they are 17 or as close to 18 as possible when they graduate. And the reason being is they can earn the license, they can sit for the exam, pass the exam, the whole 9, but they may not be hired unless they're 18, because there's equipment in the nursing homes and things that you have to be 18 for to operate. I don't know of any other age, specifically what other ages would you be concerned about?
I just think it's if you have a student, for example, that's 17 and a certification that's not the one you just gave as an example, the requirement is the kid has to be over 18 to be certified. Does those ever come across any of the other concentrations at Waterbury Academy where maybe the student has to wait till they turn 18 and maybe are not enrolled anymore to be able to get that certification?
No, there really isn't anything
Okay.
that I'm aware of in terms of certifications. I know that there are schools in and around New Haven that are interested in doing phlebotomy. Phlebotomy is not something, again, my feelings, not something that should be done in high school. Phlebotomy is definitely an 18-year-old license, and it should be, in my opinion, obtained after high school. So that is something that I will not support at the high school level here in Waterbury. Some other districts are considering phlebotomy. Again, my beginnings in Palm Beach County, phlebotomy was there, but the students were 18, or they did it after, or they entered into a phlebotomy course after graduation. That's not something that I would support in a high school setting. Okay. Just continuing on with non-traditional students. Males in health science are considered non-traditional. And so for me, it was important to bring courses and coursework in that interested the male students, that interested, so surgical tech, pharmacy tech, that interested. And one of the students on the right, Randy, with the green pencil, he's graduated from UConn School of Pharmacy, and these three students were in the pharmacy tech class. So bringing in coursework that is going to interest your communities. Our EMT students, biology labs. Haley and Sienna graduated last year. This was taken as they received their scholarships from Central. Haley is a member of the National Education Rising Cabinet. This was taken at Quinnipiac School of Law. They were invited down to receive their scholarships, and that was a very nice evening for them. So community collaborators, community and industry academic collaborators. So over the years, these are the collaborations that we have and that currently exist. So our hospitals, our Department of Labor, our OSHA training goes through Career Safe, American Red Cross for our blood drives, our UConn collaborations, our ECE, our Health Center in Farmington. We have a global leadership initiative, which is specific, I believe, to Waterbury, where Waterbury Public School students are paired up with a student at Taft, and they work on a project, a leadership project. Department of Health comes in and provides our public ambassador training, our collaboration with the National Registry for EMTs, the paperwork and the accreditation we need there to run our EMT course, our manufacturers, Clydell manufacturers, our elementary schools around the city, State Street, Wilson Elementary, our international school, Post, Gear Up, and Southern. So this is the most comprehensive list I have at this point of who our partnerships are with. So getting into industry, the incentive for students to gain mastery for industry-ready credentials and taking ECE classes is we have a career-ready cord. So students who complete their OSHA training and pass 1 or 2 precision exams for content mastery will earn this graduation academic cord. So that is an incentive that our district initiated, which has been a tremendous incentive for our students to go the extra distance outside of the classroom, outside of the coursework in the classroom. So at Career, we offer industry-ready credentials through Career Safe, and our main industry credential is OSHA training. So all students in 10th grade, when they select their academy, begin with a Start Safe, Stay Safe, and Work-Based Learning online modules. So every 10th grader at Career Academy is completing these modules. In 11th grade, they move on to cyber awareness, all within the umbrella of the Career Safe company. And then in 12th grade, they are required to do OSHA 10. And the OSHA 10, I've broken it down. We have the training library where the health science students do OSHA 10 preparation in healthcare. We have OSHA 10 in manufacturing for the shop students. And then we have general industry for the other. We also do a public safety for the EMT students in OSHA 10. In addition, I am a CPR instructor through American Heart. So we are credentialing students in CPR and AED. Our EMT teacher is certifying students in Stop the Bleed. In IT, we have the CompTIA, Parapro exam, and then, of course, the U-Science or precision exams, which are the written exams for content mastery. So the U-Science exams, are you all familiar with the precision exam, U-Science exams? No? Okay.
Linda, why don't you do a little bit of background about it then?
Yeah.
Please.
So, so back in 2000, for those that are on the call that perhaps remember the NOCTI, which was it was a state mastery exam for the CTE courses, and the students would take end of senior year courses to assess their career and tech ed, the mastery of their courses. Well, when the NOCTI went away, and for me as a new teacher, I had no way to assess whether my curriculums were working. And so in 2018, I had met a gentleman at a conference I was in Dallas, and he was starting a company called Precision Exams. And it was for health science. And I came back to school and I said to my principal, we really need to test the students, to see if these curriculums are working. And so I contracted with him with Precision Exams. So this was before districts kind of were doing anything with Precision Exams. And so it offered me the ability to gain access to an exam that would test students along the lines of national standards. And so it helped me develop the health science classes. So in 2020, the city of Waterbury decided, okay, we're going to contract with, now it's called U-Science, and contract with them, gain access to their catalog of all of their exams, and we're able to make them available to all CTE students. So that is how we assess our content mastery. So over the years, so as I said, I began doing this in 2018 with the health science students, and now we have all of these content exams at our disposal. So our health science fundamentals, medical terminology for the medical lab, medical assistants, anatomy and physiology, nurse assistant and EMT for health. We also have 21st century skills, and these just, we have tests in manufacturing, we have tests in drone, unmanned aerial systems. For the financial literacy requirement, we have personal financial responsibility and a general financial literacy exam. And what these exams do is they offer a pre-test, a single exam, and a post-test. So in September and October, as a department, all the CTE students will take a pre-test in their content in their academy. We also have access to single tests, which teachers use as middle of the year assessments. Some use them for midterms. And then at the end of the year, once the, closer to the end, April and May, we administer the post-test. And this data provides us with growth. It provides us with areas, for feedback for the students. And if they earn a passing score on the post-test, they have achieved a certification. So just a slide on where we are right now. So our current enrollment is at 723. We have maintained a 97, 98, 99% graduation rate since our first graduating class in 2017. We have 13 ECE instructors. That includes me. We run a 7-period traditional schedule, no study halls. 78% of our students are enrolled in our OSHA industry credential modules. And when I reached out to Precision Exams, they were able to provide me with data for the last 5 years. So we've administered over 9,000 exams, both, that includes breaking it down for single assessments and post assessments. So basically at the beginning of COVID, we have had a 55% pass rate, certification rate on our precision exams. Any questions on the industry ready credentialing? Okay, so on to our dual enrollment. Dual enrollment, early college experience that we offer at Career Academy. So as I said in the beginning slides, within each academy, we have dual enrollment course offerings. So we have 90 CTE students currently enrolled in ECE classes. The educator students with the UConn Introduction to SPED and Love It, Teach It, and then the 3 UConn courses in the Health Science Academy with Medical Terminology, EMT, and Intro to Allied Health. In addition, we have 114 students in our UConn Bio, UConn Chem, English, and Western Traditions. So 200, and then with CT State, we have 55 students enrolled in the Advanced Manufacturing 1 and 2 collaboration with CT State, and we have 10 students enrolled in the post management and leadership courses. So we're coming in about 269, 270 students in total enrolled in dual enrollment over the 11th and 12th grade. A big part of our success, and if there's any school counselors on the call, our school counseling is huge in placing students, not placing students in the academy. Students choose their academy. So school counselors will, at the end of the freshman year, they send out a survey to the students, to the freshman students, asking them to rank which academy they'd like to go in. So once we get back those results, then we move into, then we're scheduling over the summer those students into those academies. The dialogue between the school counselors and the teachers and the students and families, it's ongoing. We encourage students to talk, with us, with the CTE teachers. I've invited students to sit in on CNA class. Miss Richard, what do you do in CNA class? I say, if you can come in, I'll call your teacher, come in the afternoon and see what we do. Scheduling is probably, if not the most important key to successful CTE programs. And our school counselors really have work both sides with the academic and the career and tech to make sure that the student schedule is exactly what's going to meet their needs and their abilities. All right, so I'm just going to run a couple slides with some of our graduates. So over the years, I said we've actually had 9 graduating classes from 2017. And Diana was one of our first to go to Harvard. And Diana was 2018, 2019. She's finished up law school and working in New York. Argenis was a health science student. He was incredible. He went on to Williams College, and then I believe he's finishing up at Harvard Law. Randy and Haas from our last year's graduating class, they're both at Stores. They were our valedictorians and our salutatorians of the class of 2025. I know Randy was, but I don't know. I think both of them were Day of Pride scholars. Christy was a student who graduated from Career Academy, and she is currently at Brown. So you can imagine when the incident at Brown happened, I reached out to her and she was in her physics exam. And I texted her and I said, "Are you okay?" And she said, "We're, hunkered down in a basement with 145 other students. We were taking our physics exam." So that was a tense moment for us, but Christy is majoring in biology and will be continuing our studies at Brown. We have Shirley, we have a lot of students at UConn. Shirley's in her grad studies with biology. Lots of nurses, way too many for me to mention. But most recently, Janai reached out. She had finished her RN and nurse practitioner at Howard University, and she's going to be starting the registered nurse anesthetist program at Fairfield in the spring. We have students who have gone on for school counseling and psychology.
Oh, excuse me, Linda. Just
Yes.
want to know we're at time. It's 11 o'clock.
Oh my gosh. Oh my gosh.
So, we will share Linda's presentation when we send out the link for the video. If anyone has any more questions, please communicate them to us. I think we addressed everything in the chat. If not, please let us know. We can definitely get back to you with that. I just want to remind you the next meeting is on February 19th. And in the email that Karen Amaker shared at the end of the calendar year, she did ask if anyone was interested in presenting to share that information with her. So that would be something that, if you would like to showcase your school or have any topics that you'd like us to talk about, please respond to that email. I think she sent it somewhere right at the end of December. So that information's there for you as well. And I would just want to thank everyone for coming. Thank you very much for Linda. It was a very informative presentation. We really appreciate you taking the time to present that to us today. And I just wish everybody a nice day. Thank you for coming.
Wow, time flew.